Hi my beauties, welcome back to Younger. Today I'm coming to you from the beautiful island of Maui, Hawaii, but rain or shine, and no matter where I'm traveling, I will always post every week to drop some knowledge and to educate you guys. So today we're going to be talking about the lip flip technique because this comes up a lot with many of my patients. I know it's trending right now and a lot of people have a lot of questions about it. So basically, when you're referring to the lip flip technique, there's two ways you can lip flip, and that's by using Botox and by using filler. But the majority of the time is pertaining to Botox. So what happens is, when we smile, there's a muscle that goes around the mouth called the obicularis oris. And when we smile, some people's anatomy contracts so hard that when you smile, your upper lip thins out and it curls in and it becomes almost non-significant or really, really thin. So patients will come in and they'll show me selfies like, look, my lip disappears, my upper lip is gone when I smile, or I see this happening to my mom or my grandmother and I don't want this happening to me. So basically what we do is we do Botox in a little area around the mouth, just 4 units of Botox, which is really, really minimal. Just to put these in perspective, usually we do 20 units of Botox for the 11 line. So 4 units is really, really a small amount. And we basically do one, and we do those injections around the mouth. So what happens is the obicularis oris muscle that goes around the mouth isn't able to contract as tightly. So if you take your fingers and you kind of push on your upper lip and you smile, that's what Botox would do. If you let it go and your lips curl underneath, then you'd probably be a good candidate for the lip flip injection with Botox. And so by doing that, it just kind of just relaxes those muscles so you can't smile really hard and contract your lip. So this is in contrast to the gummy smile of Botox. So Botox for gummy smile, and what is a gummy smile? So gummy smile is when you smile and you have a lot of gum showing, like between the upper level of your upper teeth and the gums. So when people smile and a lot of gum show, it's not usually cosmetically elegant to have that. So you kind of want to calm that down so your lips don't go up so high when you smile. Now the way we do that for gummy smile is just 1 unit of Botox in the apical triangle. That's right here and right here. So just to educate you guys, because a lot of providers are doing these procedures that may not have adequate training, and I want to protect you from having a bad outcome. Gummy smile, Botox here to kind of keep that down so you don't smile and it doesn't rise up as high. And then there's the lip flip on the other end, where you could do a unit here, and it basically just allows your lip to stay full and puffy and with volume, even though you're smiling really hard. So that's the lip flip technique using Botox. Now another thing that happens in people who are maybe 30s, 40s, or 50s, or even older, if they're starting to get little lip lines or their lipsticks like running into their lip lines, or even if you're younger and you want to prevent that from ever happening, say you look at your grandma or your mom and you're like, oh my god, she has lip lines with her lipstick running in her lip lines. That's what you want to avoid, and the way that we can do that is preventative Botox in the same areas that we would inject to protect you from having, your lips go away when you smile, which is the lip flip technique as well. So lip flip technique and the preventative Botox around the mouth to prevent lip lines from happening are basically the same thing. The Botox goes in these areas around, it's just called the vermilion border, where your white part of your skin meets the red part of your lip, and that's where we do the lip flip technique or the prevention of lip lines, which is basically the same thing. So another reference sometimes that comes up is the lip flip technique using filler. So the filler that we use in the lips is typically a hyaluronic acid-based filler. I like Volbella and Velour. I think it's the new Cross technology. I'm a really big fan of it because it lasts about 18 months to 2 years. It integrates into the tissue very beautifully and very naturally. And again, just because it lasts 18 months to 2 years is a really longevity that I really like a lot. And so the old school kind of Hyalocross or like Juvederm or Restylane, those are a little bit more old school and they don't last as long. They typically last 6 to 12 months. So I like Volbella and Velour. They give me really natural and beautiful results and they last a long time. So that's the hyaluronic acid-based fillers that I prefer. But a lot of other providers may use other brands, other molecular configurations, but those are my favorites. But when you're talking about the lip flip technique and you're referring to filler, what that is tunneling. So if you guys come across different injections online, you can see that people usually inject along the red part of the lip, and that's kind of the standard way that we inject. And then sometimes, we can do it in the philtrum, which are these 2 columns that pull up on the cupid's bow, which is this part of the lip right here. And by doing the tunneling technique, you kind of go against in a perpendicular way. So basically what tunneling is when you inject this way and you're pulling up on the lip because you're injecting in this type of pattern. And so that's also referred to as the lip flip, but usually it's referred to the Botox. And so there's two ways you can flip the lip, and I think that if someone is just kind of thinking about doing filler and they haven't really gone through with it yet, and they maybe want to see what the results are like, I think doing lip flip with Botox is a good idea, because what it's going to do is it's going to make your lips look fuller without having filler placed, by just kind of relaxing that muscle so they don't contract and go away when you smile. So it's always a good thing to just like dabble in if you want to just dip your toe in the water and not jump in the pool and see what those results are like. Typically the Botox will kick in about 4 to 5 days after injection. Sometimes it takes a full 2 weeks, but I always like to tell patients, don't freak out if you don't see your lips fuller when you smile, after a couple of days of having Botox, because it may take a full 2 weeks for you to see the results. And then it usually lasts about 3 to 4 months. Botox typically lasts 3 to 4 months, but sometimes it can last 2 to 3 months in people who are more fit, more active, because they burn through it faster, their metabolism's higher. I work out a lot, so Botox on me only lasts about 2.5 months. So what happens is when we have people come in for the lip flip technique using Botox, we just do 4 little injections. It seems like it'd be painful, but if you have a very gentle practitioner and a really tiny needle, a 32 gauge needle is the smallest available on the market. That's what we use. That's what I always use on my patient. It's usually very, very tolerable and not that bad at all. The pain is probably like 2 out of 10 on the pain scale, 10 being the worst. So it's not that painful, just 4 little injections, really superficial, really easy. You're not swollen, you're not bruised, and you can go back to work. Nobody's gonna know you had anything done. And then in about 5 days, you'll start to notice that your muscles in your mouth are a little bit weaker. And then that lasts for about 24 to 48 hours, and then you notice the results. So it's just, you feel like a little bit of weakening, but it doesn't feel weird, and it doesn't inhibit you from doing the normal things that you would do with your mouth, drinking through a straw, kissing your guy, doing whatever you're gonna do. You can still use your mouth like you normally would, but you're like aware of it, and then it goes away, and then it just looks good, and it lasts for about 3 months. So that's the lip flip technique using Botox versus lip flip technique using hyaluronic acid fillers. So I'm going to probably do a whole different episode just on lip fillers and lip injections, and I'll talk about the different fillers that we use and the different techniques, because I know you guys ask about that a lot, and it's a very popular and trending procedure that we like to do a lot in the office. And I'll kind of get into that a little bit more, but basically the way you do lip filler is you just naturally enhance what God gave you. So everybody has different lip anatomy, and you never want to look overdone, you just want to look better, and there's techniques that you could do to achieve that goal. And so we always call filler injectable lip gloss. The way your lips look when you put gloss on, how they're all smooth and glistening and full and pouty, you want that all the time without lip gloss. And that's what fillers, when done correctly, should give you. If you guys follow me on Instagram and you go on my highlights where you see lips, my before and afters, you'll see that they're very naturally looking, but they just look better. And so everybody's lip anatomy is different. Some people want a bigger bottom lip, some people want a bigger top lip, some people have asymmetry between both sides. Some people want more of a philtrum, some people don't have a philtrum, or they want a Cupid's bow. You have to just take a patient by patient basis and just customize the lip injections and lip filler to treat that patient. Now sometimes we do Botox in combination with filler, but usually I'm more conservative and I like to do a stepwise approach. I always say successive approximations to your goal to give the best outcome. So sometimes people will have Botox and see how they do with that added fullness, and if they want more, then we do filler. Sometimes people at the gate know they want their lips fuller, they've had it done before, and we do Botox and lip filler at the same time. And then probably I'd say 60 to 70% of the time we just do lip filler and that's all. So everybody wants a little bit something different. You can make it look very natural, very balanced and in harmony. And that's the key. You always want to customize your lip injections to each individual patient, their lip anatomy, what they're looking for, what they want. And if you bring in selfies or if you bring in other patients' lips who you like, you can always try to use that as a goal to try to achieve, what another person who you like has. So you can add a little bit of filler to make the upper lip bigger, the bottom lip bigger, open up the angles of the mouth, and even from the profile, kind of make them look more full. So there's a lot of different techniques, a lot of different tricks, a lot of different fillers you can use. You just have to go to an expert injector who knows what they're doing, and to customize each individual treatment for you and your face and your lip anatomy to make you look your best. I hope this helps. Don't forget to like, comment, and subscribe, and share this video with anybody else who you may think that is interesting. Aloha!